Mariejo Constant on healthcare values, compassion, and service. Mariejo Constant remembers the moment healthcare stopped being an abstract idea and became personal. A family member was navigating a difficult medical journey, and Constant found herself on the other side of the system, trying to help someone she loved find their way through it. The experience stayed with her, supporting them as they struggled to find their way through the complex health system opened my eyes to the need for significant improvements, Constant says. That single sentence explains a lot about her. Not the credentials, not the titles. The listening, the noticing. The refusal to look away when someone is scared and confused in a hospital hallway. Mariejo Constant has long valued compassion, service, and care for others. These traits run through her story, whether she's talking about family, faith, or the food pantry she's run for more than 15 years. Her path toward healthcare started somewhere ordinary, a sister's career. My passion for healthcare was inspired by my sister, a registered nurse, Constant says. Her stories about the profound joy she felt when helping patients recover, witnessing them leave the hospital healthier, and experiencing their deep gratitude highlighted the rewards of patient care for me. Two things pulled at her at once. One was joy, watching someone get better. The other was struggle, watching a loved one get lost in a system built more for process than people. Both mattered. Both still do. Mariejo Constant's healthcare background and personal values. Constant's connection to healthcare didn't arrive through one dramatic event. It built over years, shaped by family experiences and by moments early in her career that taught her something no textbook could. Early in my career, I assisted a patient who was extremely anxious, which taught me the critical importance of being sympathetic, empathetic, and patient with those in vulnerable situations, she says. That kind of lesson doesn't show up on a resume. It shows up in how a person talks to someone who's scared. It shows up in whether they rush or whether they sit down, pull up a chair, and actually wait for an answer instead of moving on to the next task. Mariejo Constant has pursued advanced study in public health, work she describes as driven by a desire to understand health at a broader, more structural level. Her interest isn't about clinical performance metrics or procedure, it's people. What happens to them when the system fails, why some fall through the cracks while others don't, and what it would take to catch them before they do. She talks about wanting to teach one day, to mentor people entering care-focused fields. Not because she wants to lecture from a distance, but because she remembers what it felt like to need someone who actually understood the stakes. Someone who wasn't just going through the motions. I aim to conduct impactful research that enhances patient outcomes, she says. I also aspire to mentor the next generation of healthcare professionals, guiding them through their studies and inspiring a strong commitment to excellence in patient care. There's a teacher's instinct in that. Not the kind that stands at a podium. The kind that shows up early, stays late, and remembers what it was like to be the one who didn't know the answers yet. A patient-centered mindset rooted in listening. Ask Constant what matters most in a vulnerable moment, and she doesn't talk about procedure. She talks about attention. During difficult or vulnerable moments, I believe it's crucial to be patient and show genuine empathy and sympathy, Constant says. I make it a priority to be a good listener, giving the person my full attention and understanding their needs. Simple words. Hard to actually do. Anyone who's sat in a waiting room, watching a clock, knows how rare real attention is. Constant's approach treats people as more than problems waiting to be solved. A patient isn't a chart. A neighbor isn't a task. She frames care as presence first, information second. It's important to provide a caring presence that reassures them they're not alone in their struggles, she says. That's the piece that tends to get lost. People remember how they were treated long after they forget what they were told. Constant seems to understand that instinctively, maybe because she's been on the receiving end of both good and bad versions of it. Dignity comes up often in how she describes her outlook, though not as a buzzword. More like a baseline. Something owed to people, not earned by them. Mariejo Constant's service extends into family and community. For Constant, healthcare values don't stay inside a building. They follow her home, into her church, into her neighborhood. She's directed a community food pantry for more than 15 years, work that sits at the intersection of nutrition, service, and public health. This work is deeply meaningful to me as it allows me to serve my community and promote well-being, she says. It's not glamorous work, sorting cans, managing volunteers, making sure the shelves don't run empty on a Tuesday nobody's watching. But it's consistent, and consistency is its own kind of compassion. She also volunteers with a literacy nonprofit, focused on improving reading rates in underserved populations. On the surface, that might seem separate from health. It isn't. Literacy shapes whether someone can read a prescription label, understand a diagnosis, or fill out a form without shame. Constant connects the dots between education and equity without making a speech out of it. I am deeply committed to education and equity, which drives my community involvement, she says. Family sits at the center of all of it. Constant describes herself as a mother and a wife first, roles she says ground everything else she does. I want people to see me as a multifaceted individual, she says. Beyond my online persona, I am a mother, a wife, and a doctor deeply committed to effecting positive change in my communities. Lifelong learning shapes her approach to wellness. Constant treats learning less like a phase and more like a habit. She reads development literature. She attends workshops. She keeps circling back to the same question: what more is there to understand about how people stay well? Resilience is a word she returns to, and she defines it plainly. Resilience is the ability to bounce back to your baseline health and mindset after encountering a setback, she says. She credits a strong support system, family and close friends, along with exercise and mindfulness, for helping her hold steady through hard stretches. Preventive habits matter to her. So does awareness, the kind that helps someone notice a warning sign before it becomes an emergency, or check in on an aging parent before a small issue turns into a crisis. Wellness, in her telling, is shared. Nobody carries it alone. No matter how difficult a situation may seem, maintaining a positive outlook and persevering can lead to growth and success, Constant says. Each obstacle has taught me to adapt, learn from my experiences, and emerge stronger on the other side. That belief runs through her food pantry work, her literacy volunteering, her interest in public health research. Different rooms, same instinct. Mariejo Constant's story isn't really about titles or timelines. It's about what happens when someone decides that care, real care, doesn't stop at a job description. It's carried into how a person listens, how they show up for family, how they treat a stranger having a hard day. That's the version of healthcare she keeps choosing: patient, steady and human.